automatically a sentence of death. Well, because we don't have a specific treatment for the COVID, treatment is supportive. So that if we can keep you breathing, if we can keep your kidneys going, your heart going, everything going, we can get you, support you through this. It seems like many people recover. Many people can get better. Many people can recover even from the ventilator. So there were some early thoughts that said if you were on a ventilator, it was a sense of death. You might as well pack it in. In some cases, that's true, particularly if you're finding trouble with your heart and trouble with your kidneys and trouble with your brain all at the same time, okay? It's more a manifestation that the infection's all over your body and we're trying to keep up with it. But going on the ventilator itself is not a sentence of death. Right.
So describe for us what the normal course of treatment is for COVID patients. Why is it that some go to the hospital, some stay at home, some are recommended to stay at home? What's the regular course of treatment?
Here's what they're not telling you. The biggest problem is a shortage of tests, okay? Because we don't have enough tests, you have to prioritize them. All right, because no matter what Trump says in the White House, there are not enough tests to go around. So let's back up. If I feel I am getting coronavirus, what can I do? Okay. Now, I should say, yes, coronavirus anxiety is real. There are times I get a sore throat and I'm wondering, I start coughing, or and I'm wondering, is this a start? All right. Now, now here's one thing people should know. You're going to need a PCP. Somebody has to order the test. You can't, there's no walk-in clinic, there is no screening place. You can go and get the test on your own. You have to you have to talk to a doctor. What the doctor will do, because there's a shortage of tests to prioritize it, they will talk about your risks. What are your risks? Your age, any other conditions? Have you been exposed? Now, if you were said, I know my roommate was tested positive for COVID, that puts you in a higher risk. That means you are more at risk. Therefore, testing is more indicated. However, if you're just coughing a little, if you're not sore throat, if you're not having trouble breathing, okay? One thing I like about video, now in this new computer age, I do video conferencing. And one thing I can look at is how you're breathing. Similarly, since I have, remember, my practice predominantly lung disease, a lot of my people cough and are short of breath all the time. So I can talk to them on the phone and hear them, or even better, see them on the computer and look at them. Are they working for their air? Are they able to talk to me in a complete sentence? Are they coughing while we're talking? Are they wheezing while we're talking? These are all ways I can tell whether it's worthwhile for you to go to get a COVID test. And again, because of the process, I order the test then, but the test is insurance specific. If you have UPMC insurance and you don't go to a UPMC lab, you are out of network and they will bill you. They've not changed the rules for balanced billing. Trump has said that testing is free. That's not written down, especially if you go out of network rather. And also, treatment is not free. So you are going to need a doctor, okay? Now, if you don't have a PCP, if you can call, all these insurance companies have helplines. They will be happy to hook you up. If you have a question, the magic phrase is, I want a telephone visit, okay? Because they can arrange that very easily with a doctor and hook you up that way with somebody. That one can be across the system, all right? So if you have a question, if you think you may have COVID, you can call and get more information. Now, I have to say something else. Don't be afraid to go to the emergency room if you think you have to. One of the terrible things I've seen now are patients presenting with later stage disease. I've had 2 patients in the past week who came in with perforated bowels because they had pain, abdominal pain. It kept building and kept building, but they were afraid to come to the emergency room because they were afraid of getting COVID until the bowels ruptured, and then they're septic, and then I have to work really hard, okay, and they're really sick. So one of the things I would emphasize is that your other illnesses haven't gone away. If you have a history of heart disease and you start having chest pain, go to the emergency room. That heart disease hasn't gone away just because of this pandemic. If you've had trouble with sugar and you've not been watching your diet because you're at home and you're depressed, and what's the point now? And those Girl Scout cookies are calling you, okay? Ketoacidosis still occurs. Don't be afraid to go to the emergency room. If you have, and in my case, particularly with my patients, if you have COPD, okay, that can worsen on its own independent of the pandemic. So one thing I want really emphasize is don't be afraid to go to the emergency room. If you have symptoms that might be a stroke, trouble speaking, problem with balance, coordination, arm weakness, go, call on, go to the emergency department anyway. Your risk of the strokes still happen, heart attacks still happen, okay? Perforated bowel infections, diverticulitis still happen, but I'm seeing patients present later in their illness when they're sicker and they're harder to take care of. So one thing I would emphasize, and you pass it on to everyone don't be afraid to go to the emergency room. Okay.
Okay, thank you.
Oh, in particular, one thing to watch out for as it comes to mind, dehydration. One of the most common reasons people get real sick from COVID and from influenza and from other things is that they get dehydrated. If you're not taking in enough fluids, and that makes everything worse, particularly your kidneys, makes your heart, all right? So one thing they will ask you if they're worried about COVID when you talk to someone about it is, are you able to eat and drink? Because you certainly need to keep up your fluids, okay? Water. And particularly water. We're not talking, I mean, I had one patient who told me he was keeping up his fluids. He was drinking, a 12-pack a day. And we had to talk about that. Because keeping up your fluids does not mean drinking that much beer, okay? But that's a sidebar. But for the rest of us, drink water, drink your fluids, keep hydrated.
Yeah, I'll have to test you on that 6-pack, perhaps of Corona. We've been told that a vaccine is about 18 months away from being available to the general public. If that's the case, how would we administer a vaccine, and will there be a priority protocol?
All right. First, why do vaccines take so long? Remember, a vaccine is to protect people against an illness, which means the first issue is safety, right? You've got someone without an illness who you're giving them something that you want to make sure it doesn't give them the illness, okay? Which is why it's first tested for safety. Then it has to be tested, does it work? Which means you have to wait a certain amount of time to see, do people with the vaccine not get sick? And then the third issue will be, you've got to scale it up. You've got to you're talking about needing billions and billions of vaccines. Unfortunately, the Surgeon General has said that Corona is our Pearl Harbor moment. For Black people, it's our Katrina moment, because it's one more episode where a disaster, where a hurricane, a natural disaster is coming, okay, and the government, we can't count on the government to step up with us, right? We've already discovered that money still talks. We know that those with great incomes have gotten tested more easily, okay? There are people who are hunkering down and sheltering in place on their yacht, okay? So unfortunately, there is no reason to think that a similar thing won't happen when a virus becomes available. The other issue is going to be, especially with the vaccine. I'm sorry, with the vaccine for this virus, is safety in the most frail, the vulnerable population. All right, you really want to be sure that the vaccine is safe for the elderly, for those immunocompromised, for those with the comorbid conditions.
So we know that African Americans are dying at a much higher rate than their white counterparts. Mm-hmm. Tell us what the contributing factors are to that.
Unfortunately, the coronavirus pandemic is on top of the epidemics of obesity, diabetes, hypertension, heart disease that already afflict the Black community. In addition, we are the ones most likely to be on the front lines. Only 20% of Black people are able to work from home. The rest of us have to go out and meet the man, okay? We are the ones who have to ride the bus. We're the ones stocking the shelves. We are the ones delivering the mail, okay? We are the ones taking care of other people so that we are more on the front lines. We have not been served well by America's health system. We are less likely to have health insurance, less likely to have concurrent care. We have more trouble paying for our medications, getting our medications. So the social and we are more likely to live in close quarters. It's hard to self-quarantine in a multi-generational household. It's hard to self-quarantine if you're all living together. So the problem, the virus has brought out once again the breadth, length, and depth of the inequities in that Black people have in America, which is why I call it our Katrina moment rather than Pearl Harbor.
Mm-hmm. Mm-hmm. Some states haven't kept statistics according to race and ethnicity, including Pennsylvania. So how does that lack of information affect outcomes, data, planning, treatment options from a public health perspective?
From a public health perspective, it's all of the above. White people are always surprised that Black people are getting sick, okay? They always, HIV, pneumonia, heart disease, hypertension, all along. The fact that and also another problem is we don't get the tests. We are not okay. When they did a study, they showed that just like education, one of the strongest when the people who live in certain zip codes are tested more. Testing follows money, okay? So that the African American community, if you're poor, you are less likely to get the test. Because they're less likely to have insurance, less likely to have a PCP. So that's another reason why they don't keep it. Because they don't keep track of the numbers. We don't know how bad it is, okay? When they talk, the initial thought was that the reason Black people were dying more was because it was our fault. We were more sensitive to COVID, and so it had nothing to do with racial disparities, nothing to do with anything else. It happens that because we have more comorbid conditions, okay? We can die more. We don't get it any more frequently, but because of our particular situation, lack of insurance, lack of healthcare, comorbid conditions, obesity, hypertension, we are more likely to die of the illness. Oh, one other thing. We are also more likely to present at a later stage. It turns out that it appears from initial studies, one of the chief reasons African American men die at higher rates than African American women is because we present later. You know, we are told to be stoic, to suck it up. We are also more likely to be working in harmful conditions. It looks like we are also more likely to smoke. Men are more likely to drink alcohol. You know, all the conditions. Less likely to take our medication. Less likely to follow up regularly. So, and that again, one thing that this pandemic has brought out is the reality that men in general, but African American men in particular, hold it in. We present later for medical attention than others do, even women. Okay, even controlling for insurance, controlling for income. Black men seek help less readily.
Mm-mm-mm. So we just recently heard that hydrochloroquine, you know,
hydroxychloroquine,
yeah,
Trump's drug.
okay. Has been the anti-malaria drug was recommended early on by our president as a possible treatment. We heard day before yesterday that in VA hospitals, that has been proven to be very false. And as a matter of fact, those who took the drug died more rapidly than those who did not.
That is correct.
Are we taking that out as a possible option? Have we ditched that? We know that yesterday the physician who was developing the vaccine, who talked about the drug, has now been fired.
That's right.
So is it now removed as an option altogether?
That's not removed as an option altogether because Trump don't want no bad news. Okay, he, so he believes in it. Because he believes in it, he's surrounded by toadies and psychopaths who, want their job and are going to give the man what he wants. It is still there. The problem with hydroxychloroquine, okay, first, it is good it's where does it come from? It's actually a good anti-inflammatory agent. It's used a lot for inflammatory conditions such as lupus, sometimes rheumatoid arthritis. I've used it for, I've had patients on Sarcoid on it, okay. The problem is, in terms of the side effects, if too high doses, it can cause retinal blindness. And more importantly, it can cause cardiac disease. Particularly, it causes irregular heartbeats. And the people who it looked like the people who got into trouble with it had died of heart disease. So I doubt it will be off the table, because the man who got his name put on your stimulus check loves it, okay? And he never believes he's wrong. He never believes, he never says he made a mistake, and he doubles down on everything. But the point is, it doesn't work. There are a lot of trials. There's particularly one, Radimavir, I'm not sure I'm pronouncing its name right. It was an agent that was actually developed during the SARS-CoV-1 epidemic in 2003. Because it died, the epidemic burned out on its own, nobody knows why, before they could get the testing completed, and then the funding dried up, so they never pursued it further. However, it and a number of other antiviral agents do show some promise for treating the disease. At this point, we've got nothing specific. You hear all kinds of anecdotes. Oh, and whatever you do, don't believe anything on the internet about having a cure. There are some churches that was presenting colloid silver as a treatment for COVID. There was a shyster who was selling a type of bleach that you were supposed to drink, okay, to treat your COVID. I mean, none of those stuff works, all right? This is one time where, because of the fear, because of the anxiety and the need to do something, there's all kinds of stuff coming out of the woodwork. There was there was a crew that was saying that if you washed your hands with vodka, it was better than sanitizer. No, vodka. You got to take vodka. You drink it, all right. Don't mess around with it. Don't waste it on the counter or on your hand. Okay, I'm just saying.
Oh my God. Do you, in your opinion, and this is just your opinion, have we reached the height of the curve yet?
Okay. First, what do we mean by the curve?
Yeah. Yeah.
So what we're talking about, what they found particularly in Italy, also in Spain, is if you get more cases than your health system can handle, that's when people die. Remember, we talked about if you get bad, you need support. You need ventilators. You need people to run the ventilators. You need intravenous and all kinds of monitoring things. Okay, that's a finite resource. What happened in Italy and what happened in New York is that you had so many cases that the system couldn't handle it. Okay, everything else was crowded out by COVID. In fact, I would ask you to say a special prayer for G. Currently, he's at a hospital in Newark. When we last spoke to him, out of 700 beds in the hospital, 650 beds were filled with COVID patients. That's all he sees. Okay, he wears that gear. Okay, you've seen the gear, and I put it on when I go in the ICU, and it's claustrophobic. You're wearing 2 masks, you're wearing all this stuff, and you sweat like a mug. Okay, but he wears that all day. He's putting in lines. He's working right at the front lines, and we've talked. He's seen a lot of death. Okay, and it weighs on him. So that I would ask my church family to lift him up in prayer, because he is really I worry the Lord about him. Anyway, so back to the curve. If you can keep the number of cases to a point where your system can handle it, then that's the curve. Okay, it looks like we have reached the peak, past the peak. There was one point in Sewickley where we were intubating people, 4 and 5 people a day. And for a little hospital like that, that's a whole lot. But now things have come back to a steady state. We actually have more patients in our system, the Heritage Health System, than they have in hospitals in Pittsburgh, because we draw from a lot of nursing homes. Okay, it looks like the nursing homes have been a big vector for the cases. So we now have enough capacity to handle, it looks like, to handle the cases that are going to get, and that's why you're seeing hospitals talking about opening up, doing elective surgery.
Okay.
In my opinion, another reason we've got such capacity is that people have not been coming to the emergency room. I worry that there are patients who have quietly had heart attacks, who have not gotten care, people who have quietly had strokes, people who have not sought care because of fear. All right, and I can't know that the fear is real. Okay, the thing is, as I emphasize again and again, even a diagnosis of COVID, requiring a ventilator, is not a sentence of death. If you're worried, come get checked. Please get checked.
So the current order to shelter in place and social distancing, hand washing, wearing face masks, are those still our best options?
Yep. Yes. Unfortunately, that's okay. Since we don't have any particular treatment, we don't have enough testing. So I can't reassure you if you got your cough and you're a little sorry. I can't say come get a test and we take it off the table. Okay. Because of that, social distancing, hand washing, and masks really are the best thing we have. Let's talk about those. Where did the 6 feet come from? Well, it turns out the key thing with COVID virus is it's what's called droplet spread. When you cough, when you sneeze, and the moisture comes out, the droplets, the virus carries the droplets, okay? And the large droplets, then they've even done studies and motion studies and see if you cough, generally the droplet comes out, and because it's where it falls. And it looks like 6 feet is about a good distance when most of it falls below, where you're going to inhale it. There's also small droplets now that kind of go and whiffed in the air. Fortunately for those, again, they may not be as infectious, and they may not land on you. If particles are small enough, they float in the air. Think of how if you're insects can buzz around. If you're driving your car, right? You're driving slowly, the insects are just coming around. If you're driving too fast, they come against your windshield. So for most general activity, we're just walking around, okay? You don't have to worry that the COVID's getting in your hair. You don't have to worry that the COVID's it's not like that horror movie 28 Days Later where there's the virus came out and turns everybody into vampires and zombies, okay? That it doesn't work that way, all right? This is pure physics. Now, there is some, distancing does work just because you're trying to decrease the volume that you're exposed to. Again, we don't know what the minimum particle infectious disease concentration is. How many doses do you have to get? Okay, clearly some people are more sensitive than others. All right, but we don't know the exact dosage. So, okay, 6 feet works because that's what studies have shown. Now, the reason everybody emphasizes hand washing is because to decrease the risk of auto-infection. The virus can stay on a hard surface, particularly like metal, doorknobs, plastics, and so forth. So what happens if it's on there? You take it on your hand, and then you rub your eye, rub your nose. You can infect yourself. That's why, when in doubt, sanitize. Okay, soap and water is fine. All right, you don't need anything fancy. Similarly, cleaning, any kind of cleaners work. The nice thing about the coronavirus is that it is not particularly resistant to, it's not particularly hardy. The norovirus, the one that causes cruise ship things, is hardy. It's tough. That one can stay around for days and days, okay? Similarly, the coronavirus, okay, on surfaces can live, but it degrades. It's looking more and more like the key factor again are the droplets, so that you can, yes, if you take a dish, you can culture virus from surface, from clothing, and from cardboard. But what happens, it looks like as the droplets dry, the virus degrades, which is why, even though you saw the study which showed, yes, you can grow COVID from a cardboard, Amazon has not been a vector for the COVID transmission, okay? You really don't have to keep your stuff out on the front porch for 2 days. We do. We do, because my wife doesn't believe me, okay? Similarly, a prophet is without honor in his own country. Similarly, mail has not been shown to be a vector for contributing the virus, okay? Now, certainly though, we do wash, when we bring in the groceries from the plastic bags, okay, we wash those off. We wash those things off because you don't know how many people have been in that supermarket picking up the stuff, looking at it, putting it down, coughing on it, doing anything to it. You can't assume that other people have sense, okay? So when you're shopping stuff, when I go grocery shopping, that stuff, we wipe them all off with just bleach, okay? In fact, we have a table, come in, we've got a dirty side and a clean side, come in, we put the groceries in the bag on the dirty side, take them out of the bag, wipe them off, put them on the clean side, okay? Then we take those bags outside and leave them outside for a couple days, okay? Again, just to be sure. But from what I can see from the literature, the cardboard packages and so forth, okay, it is low, okay? Now, let's talk about masks. Originally, the reason, what happened during the influenza epidemic, it turns out masks weren't that effective. With influenza transmission, it didn't seem like masks did as much, which is why the Center for Disease Control, when it first came out, was saying no masks. Now, the I-95 masks are special. They are very tightly woven because their function is so I can examine you and keep my risk down. Recognize it's hard to practice to take care of people when you're wearing a mask. If I'm talking to you and I'm wearing a mask and you don't hear well, all right? And of course, you don't need any hearing aids, okay? You do a little lip reading, okay? But okay, I have to get right up close and speak in your ear in order to be certain that you understand what I'm saying, okay? You know, not everybody does that. Some people assume you hear, but I want to be sure if I tell you something, you've heard it, okay? Because a lot of people just kind of nod and will kind of agree and haven't heard anything, all right? So I don't assume you can hear what I say, especially if I'm wearing a mask. So I wear one of those, the 95 masks all the time, okay? From when I get into the hospital, I wear it all the time till I walk out, leave the door, okay? Put it behind me. When in doubt, I wear it because I'm the oldest guy in the ICU now, so that if I get sick, I'm on the wrong side of the curve, okay, in terms of comorbid conditions with my this and that and so forth. So I have to take extra precaution, okay? Anyway, it now turns out because of the droplet spread, wearing a mask, even a cloth mask, okay, you cough into that captures the droplets. Now the small ones can still come through, but again, they don't travel as far as the big ones, okay? And you're wearing a mask, keeps anything you're coughing from coming out, but also the physical barrier then acts as another deterrent. Now again, it's not 100%, but it improves your odds. And that's why the thing is, the current, heard the phrase, my mask protects you, your mask protects me. And there's really actually some good data that both people wearing masks combined with hand washing and distancing, of course. It's not like you've got a mask on, hey, and come up close and personal, all right? You still have to keep the distance, you still have to do this, but there's good evidence that cuts down transmission, that cuts down infectivity, and that has been part of what has flattened the curve. So we have flattened, and that's adding back to the original question, we have flattened the curve enough to, so now we're talking about reopening things. But going forward, no matter what the man in the White House says, I think COVID's going to be here a long time. There's a lot of magical thinking that we're going to have, that a vaccine's going to ride to the rescue, and that's all going to disappear by summer, and things will go back to the way they were, okay? My opinion, that's not going to happen. One aspect is the fear, all right? Because we know it's spread and we know it can be so deadly, it's going to be a long time before I'm going to be comfortable sitting next to people yelling at a Steeler game, okay? The social distancing, they're going to open up businesses, but we're still going to be careful. We're still going to have to keep some distance, and we'll have to see how things go. What they have shown in Wuhan is that the virus is still out there. What happened when people started traveling back in, there were more infections again. Why? Remember, there's no immunity, which means that anyone who has not been exposed to the virus is still vulnerable. Okay, that's why, in my opinion, I think we will be doing social distancing. We will be doing wearing masks. I think masks will be actually part of the our environment for the foreseeable future.
Mhm. So you know at Bidwell we're huggers and
Yeah.
kissers
Well,
and
I've been thinking about that,
mhm,
and I think in the Jewish faith they talk about the mitzvah. You would have there was a ritual bath that you did before to purify yourself before you entered the temple.
mhm,
I am I coronavirus in my mind is not something we'll be living with. We'll be living around. It's how do we live our lives in spite of this disease, in spite of this pandemic. I could readily see a hand wash, hand sanitizer all around the church, and what you do when you come in, you wash your hands. Okay, we might even have masks for everybody. Okay, I'm not sure when we're going to be kissing folk again, but certainly, we have masks available. You bring your own, or we have masks for you to put on there. One good news is that it looks like clothes are not as infectious. It turns out that even though if you take a swab, you can and swab the clothes can get it. As the droplet dries, as your clothes dry, as the droplet dries on your clothes, the virus becomes less infectious. It's not like it's ready to jump out at you. Okay, all right. It has to be transmitted. So I could see Bidwell mitzvah, right? Where we come in, we hand sanitize, okay? Okay, once you hand sanitize, then you can give the handshake, you can do, okay, and you can hug, okay? Because clothes are not, because again, it's preliminary, the science, but it looks like from what I've been reading of the science that it's still uh, looks very promising. That will be in the future. That yes, we will be able to hug. We will be able to, I mean, I don't know how the brothers are going to do it. We're used to doing it on the street just randomly. I don't know if we're going to be carrying the sanitizer and washing our hands first, and then doing high fives, and then do the stuff that we've done. We may go back to doing the bump all the time. I'm not sure how we'll work that. But for Bidwell, okay, there eventually I can see us doing that. When the governor gives the okay to let churches open up. Here I have to say something, that we are ahead of the curve and that we did shut down, okay? We went online. It has been a particular problem in the Middle East, in Pakistan in particular, where a lot of the imams have not closed the mosques, and as a consequence, the virus just marches through. There has been an outbreak in the Ukraine because the Greek Orthodox monasteries would not close. The monks had the virus, were giving the virus to people, and now there's a worsening epidemic in Ukraine from churches. Some people have said, including pastors, that God won't let me get sick. Remember, our Lord is not. You can't expect the Lord to do a miracle just for your edification. Okay, God will do what He wants to do. I tell my patients, my job, okay, is different. When it's time for you to go to that eternal condominium, the Lord puts you in there. But my job is to see you don't have to ring that doorbell earlier than you have to. Okay, you got to meet the Lord halfway now. You don't be dumb about things. Okay, don't be expecting the Lord just to have do something different as a miracle just for you. Okay, we're not supposed to test him that way, and he won't be tested. Yahweh don't play. Okay, he's got his plan. All right, and we have to go with it.
mhm,
But as I said, I see a time when we will be able to see each other in person. We will be able to hug each other. We will be able to high five. So we're going to have to wash some hands first now. I don't know where those hands have been. Okay. I don't know. Ideally, when there's a vaccine, okay, we can have the vaccine. All right. But that's in the future. I think what we need to think of as a church is life with COVID. How do we maintain ourselves, our sanity, our in spite of this disease? Okay. Now I have to get on my soapbox and say something else about personal care, self-care. First thing, take your medicine. If you know your high blood pressure, your sugar, hasn't gone away, take your medicine. There is a tendency to, I've had patients who, oh, this is it, I'm gonna die anyway, why bother? All right. Watch your diet. I appreciate, Reverend Denise, that you're talking about diet, because now they're talking about the COVID-15, that there are 50, that people get, gaining weight because of COVID. Because they're at home, they're not, exercising, and let's face it now, comfort food is comfort. It's comfort for a reason. It was, we started during Lent, and it wasn't as hard for me during Lent, but Easter has come and gone, and those Girl Scout cookies, those Oreos are calling me, that fried chicken, all that stuff is calling me now, okay? And it's hard to resist. So that, watch your diet, exercise. Any age, any stage, you can always do something. The simplest is walking. One of the only good things that has happened with this pandemic is that it happened during the spring. We're heading into warm weather. Get out of the house, okay? Go for a walk, all right? If the weather's bad, dress appropriately, but get outside anyway. It will help your mood, and it'll help you do better. Many smartphones will come with Samsung, with some sort of Fitbit or some new exercise program on it. The simplest one is walking, okay? Any amount helps, but they've done studies. If you do 3,000 steps a day, you cut your risk of heart attack by 10%, okay? 3,000 steps, all right? And 6,000 steps is where it's really proven, okay? And 10,000 steps, okay, seems to be like, there doesn't seem to be more than 10,000, doesn't seem to be give you an extra benefit. But certainly, the more you do, the better you do, okay? Any age, any stage, okay? Similarly, there are all kinds of exercise you can do at home. Roland Ford's got some kickback line dancing classes that he's got on the web that are good. You can do that, okay, for line dancing. There are all kinds of exercise programs. There are all kinds of things you can do to get exercise so that you move more, okay? There's stretching. There's things you can do to help that. So third is mental self-help. These are anxious times. I get anxious. I pray every day as I go to the hospital because I'm at risk. It is scary, but you do what you have to do. Okay, this is what God's called me to do, and that's why I do it. But the anxiety is real. Forgive yourself for being anxious about it. All right? I get anxious and sometimes wonder about, if I get the sore throat, is this how it starts? Okay, that's why you need to prepare. Get yourself a PCP or somebody you can call. There are helplines, and the insurance companies have places they can hook you up. Tell them you want a phone conversation, and they can have it formal, okay? But forgive yourself for when you get anxious. Forgive yourself for being depressed. Remember, Satan works through making you feel you're alone, making you feel you're isolated, making you feel there's nobody going through what you're going through, making you feel like you're nothing, okay? That's Satan going in there. We all have those feelings. They come over us, okay? Forgive yourself for having them and get help, all right? Certainly, I have patients who I know are drinking more than they should because they're trying to help sleep and how to get ready. That's dangerous. I definitely have patients who are smoking more than they should. And I should say, it looks like smoking makes certainly makes the COVID worse. Vaping makes it even worse. young people who vape seem to do a whole lot worse with COVID and on respirators more frequently and die. Okay, more at risk for dying from vaping. Okay, vaping nicotine in addition to vaping a marijuana. All right, so smoking is definitely something you should not be doing. Vaping is definitely something you should not be doing. Watch out for your self-medication because it's easy for one drink to become two drinks to help you relax, to help you stay calm and so forth. That's again, remember, Satan came at Jesus 3 times. Okay, you ain't Jesus. He's gonna keep coming at you minute to minute. He's gonna come at you again and again and again. We are a community of believers. Don't be afraid to reach out to somebody. If you're having a bad day, call someone. And, I call upon all of us to look after each other, to call each other, to keep in touch. There are despair rises when you feel you're alone. Okay.
Thanks, Dr. Patrick. That's all my questions. Now I'm going to turn it over to all of you. If you have a question, just raise your hand. Just do this. Okay. So Emily, I see your hand. Go ahead.
Yes, thanks, Dr. Patrick, for all this information. Really appreciate it. But when you were just mentioning about wearing masks and exercising, when I go out to walk, I have a mask with me, but I don't have it on. Do you have to wear it all of the time when you're out walking?
No. In general, outside air is just less infectious. Okay, there's more air to dilute it. Okay, you're moving more. Now, if you're walking and you run into your boo and you can talk to, you put the mask on. Okay, take the mask with you, put the mask on. But if you're exercising, if you're walking, you don't have to wear the mask.
Yes, thank you. I always
well, you don't yeah. You get closer to 6 feet now. Okay, all right. Other people, all right. And again, part of the etiquette now. When I'm walking, okay, on the street, okay, if I see, I keep my distance, right? So if I see somebody with kids, okay, a dog, I'll get across the street. I'll move, make sure I keep the distance, all right? I don't assume they will move the distance from me, but you keep the distance.
Mm-hmm. Any other questions?
Sheila here. Hi, Dr. Patrick.
Hi.
Thank you for that information. 2 days ago, one of my neighbors in my high rise was contacted by her doctor and asked to come in because in late January to early February, she was very, very sick. And she had what we now know are quite a few symptoms that COVID represents. So how important is she? Because she never went to the hospital. He treated her by way of phone and everything, but she has to go in and get tested. So how important is she to us in here? Because we were around her. We take her food, go get whatever she needed, and just checked on her. So would she be important in this? And
yes.
Will we?
And are you in danger? Okay. First, once you're out of quarantine, you're not. I'm sorry. She's still talking. Maybe unmute her.
Okay, I got her.
Okay.
She's not. We're not afraid because she's good now. She's actually gained about 10 pounds since she's been ill. But the doctor did call her in to see whether she had the what are they looking for?
The antibodies. Okay.
The antibody. Yeah. Okay. So how important would we all be if that's the case?
Okay. Well, first, let's talk about. Okay. Well, I'll answer your question first, then I'll say a second thing about testing. It looks like the way that the body clears the COVID is through two antibodies. First, and for antibodies are little things that your body makes to help white blood cells kill bacteria, okay, to kill infection, all right? There are different types of antibodies. Okay, what they're talking about is immunoglobulin M, or IgM, which appears to be the antibody that recognizes the thing is foreign, that recognizes that the COVID's bad. Now, it causes the body to turn on its immune system to make immunoglobulin G, or IgG, which seems to be the antibody that actually, that at least in other viruses and other infections, actually takes care of business, actually kills the virus, all right? What they're doing now is, because there was such a gap in testing, they're calling patients who have a good story for COVID to come in to be tested to see if they have the antibodies, particularly if they have the IgG antibody. These people are being asked to donate a unit of blood for plasmapheresis. What happens is they take a unit of blood, they take out the red cells and keep the plasma. They then take the plasma and infuse it into patients with COVID who are real sick. That is legitimate treatment. In the first SARS, the SARS-CoV-1 epidemic in Wuhan, that was used in China to treat patients with severe infection. And it did seem to work. There are two studies, actually, one of the few times UPMC and AHN are cooperating, is that they are calling in patients to come and be tested. And if they have the antibody, to donate blood, so to donate the plasma to be used. So she would be important because two things. One, it'll answer the question, well, did I have it? Okay. Again, the body's pretty stereotyped. Without the test, we don't know whether or not she had it. Okay. So that answers that question. Two, do I have the antibodies? Which is good, because that means, as far as we have found now, if you've got the antibodies, they're protective. It doesn't mean you're going to get it again. Now, we don't know how long the antibody lasts. We don't know how long the immunity lasts. Okay, or we don't even know if that's what's really does the job in taking care of infections. It does in other infections, but we don't know if that's what it does in this infection. So it'd be important for her to know that. Third, she can do some real good, because if you have the antibody, your plasma, okay, can help other people. So if your doctor calls you to come in, I would encourage you to go, because, as I said, you can advance the knowledge and you can do some good. Mm-hmm. Now, I do have to say a sidebar about testing. All right, because all of a sudden now, I mean, again, unfortunately, COVID is part of politics now. Trump missed the boat on the first testing business, and so he overshot now. He said all kinds of tests, all right? And so you'll see tests available on the internet. Now, here's the deal. The problem with viruses is that they're really, really tiny and really hard to grow. What happens is you take a sample of secretions from the back of the throat, all right, and you put it on a slide, but then there are chemical reactions to make this RNA virus a DNA, and then grow it to the point that it can show up on it can fluoresce. It can pick up on a dye test. Okay. The biggest problem with the tests, even the best ones, are 70% accurate because you can't get a good sample. Now, if you look, and people talk about home testing, when you've seen the pictures of people getting tested, they got their head back and they got this long swab going in. The reason is you've got to get you want the test from the back of the throat. Now, how far that is, if you take your finger and you go from the tip of your nose to your ear, that's the close to your pharynx. That's the distance it's got to go. That's why that swab is so long, okay? You got to go back to the back of the throat, and you have to wait long enough to get a good sample of it, okay, to bring out, because you have to have enough sample to get a good test, okay? Sometimes they get them from the back of the throat. But the problem with doing that, of course, you risk a gagging. You know, if somebody sticks a thing in the back of your throat, you can throw up there. You're seeing tests now where they're home testing. They're talking about rubbing the front of your nose. It's not clear those are accurate. Similarly, there are blood tests that say can give you rapid results. They too have not been vetted. This is America, and people are out to make money, and so they're advertising them to the public. The problem is, to my knowledge, from what I've read in the literature and what I've read of different, none of those tests are accurate. You have to get them through a legitimate lab. I'm sorry, I ran on too long. What other questions?
Okay. Miley, you're next.
Okay. My question has to do with, summer is coming. There's family reunions, birthdays, travel plans. What is your recommendation? Should I not plan to go anywhere just to be safe? I don't want to be somebody that, I want to be cautious. So what is your expertise? What do you think regarding traveling in the summer when I know?
Okay. Justine was supposed to get married July 1st. We had to postpone that. Okay. Now, I think certainly May is going to be important. As things open up, we'll have more information. I think so that particularly if your reunion and things are later in the summer, that's more of a possibility. I think if you've got something in June, that's pushing it, okay? July, particularly later July, okay, we'll have more information. One thing we're seeing now is we've got a rolling experiment. We've got 50 states, 50 different rollouts of opening up the country. So we'll have better ideas what people can get away with, all right? And that can give you more information. I'm not sure about flying now, okay? That one's a little more shaky in my mind, okay? But certainly, late July, August, and so forth, we will have more information. You can get better advice. Now, again, if the studies show that the cloth is not, okay, flying with a mask on, possibly, wiping off everything, okay, meeting people and, everybody Purelling, okay, everyone sharing it, wearing masks and so forth. Where you'll get into trouble if you go to a reunion and Uncle Bob don't believe it, he thinks you're being foolish, he says, I never get sick, I never get flu, okay, then, that could be a problem. But your original question about traveling, okay, I wouldn't, particularly as we move from spring to summer, I think that's possible.
Okay. We have a question from Norma. Norma, I don't know how to say your last name, but I think you are muted. I think you've muted yourself. We can't hear you.
I didn't have any question. I'm just listening.
Not you. There's a second more.
Norma?
Yeah. I can't unmute you, Norma. You're going to have to unmute yourself. Okay, we'll work it out technically. Does anyone else have a question? Is that you, Marianne? Go ahead.
Hi, Rev. Hi, Dr. Patrick.
Hi.
Okay, I have a two-part. My first question is, you were talking about being hydrated and staying hydrated, but there's a lot of talk about not drinking cold water and drinking a lot of hot stuff. Okay. And my second one is that fact that if you get a flu shot every year, are your immune system stronger against this virus? That's all.
Okay. First, where the hot fluid came from, there was a thought early on that because the COVID virus is heat sensitive, that if you drank hot liquids, you could keep from getting infected. It's not true. The problem is that, you know, the virus comes in, it attaches to the respiratory cell, and you get infected. Once the virus pumps its RNA into the cell, nothing topically, in other words, drinking anything, hot liquids, you've heard about a green tea has been offered, apple cider vinegar, all those, none of those things get in, because the problem is once it's in the cell, it's in the cell. As to whether the idea that you can wash it down, certainly certainly it won't hurt you, okay, but it won't keep you from getting the virus. Now, the flu shot protects you against the influenza, right? It does certainly help your immune system. It is not clear, there's no evidence that it protects you against this virus, because this is a different virus. Unfortunately, one of the problems with vaccines is that they only seem to work, the way they manufacture, the way the viruses work, they're only good for particular viruses. The shingles shot will not protect you for influenza. The flu shot will not protect you from shingles, because the virus, so we're going to need a specific vaccine for COVID.
Okay. So Norma Sequato, I'm not sure if I'm saying that correctly. She asked, could you say more about wiping down the groceries?
Okay. It has been shown that the virus grows on hard surfaces like plastic, okay? So in the grocery store, when people shop different ways. Sometimes I've seen people pick up the meat, look at it once or twice, put it back, pick up another piece of meat, see, wait, no, that's a little bit more than I want, put that back, look at that, no, I don't think I want that milk this time, okay, well, no, that's not my brand, put things back. So the assumption is the stuff you pick up from the grocery store, in the grocery store, has been touched by an awful lot of people, all right? Sometimes the people stacking the shelves wear gloves, sometimes they don't. Certainly everyone who comes through, some of them have used the hand sanitizer, some haven't, some of them wear gloves, some don't. You don't know, right? Consequently, erring on the side of caution, because we're bringing stuff in that has been probably touched by a bunch of people on a surface that is known to hold the virus for a long period of time. Out of an abundance of caution, I bring in the bags, put them on the dirty side of the table. As I take them out of the bag, I'll wipe them off with a bleach wipe, put them on the clean side. Wipe on bleach wipe and put them on the clean side, okay? Is that necessary? I don't know. Am I paranoid? Yes, I am. Is my wife even more paranoid? Definitely. Okay. So and because of that, and for peace at home, okay, I wipe off the stuff. I wipe it all off. Okay. Now your fruits and vegetables you're supposed to wash off anyway. All right, independent of that. But all the packaged stuff, the crackers and everything, okay, it won't hurt. All right, and it might just help.
What about pets, carpets, floors, and shoes?
Okay. Turns out that animals can get coronavirus. The original coronavirus, most of them are species specific, so that the original coronavirus came from a bat that somehow it infected a mammalian host, probably a cat, because the last ones have come through civets and then grew enough and then could infect people. Yes, cats can have coronavirus. There's no evidence that you can get COVID from a cat. All right. Yes, you can snuggle your kitty all you want to. Okay. You can snuggle your dog all you want to. There is no evidence that you're going to get anything from them. Except, well, I assume we're not talking about fleas or anything like that. We're talking about the virus. All right. About the virus. There's no evidence that it, you get it from carpet, okay, unless you, again, we're talking about the T-zone, all right? Unless you down licking the carpet, I wouldn't worry about it, all right? Now with shoes, because I work at the hospital every day, okay, I've changed my routine, all right? I have a pair of shoes in the that I have at the. I mean, when I used to go to work, I'd have my bow tie on, my suit. I look sharp, okay. But now I change into scrubs. I've got a pair of shoes there, sneakers that I wear all day. Those shoes stay there. I come home. The shoes I walk home in, I leave in the mud room, and I wear sandals. Okay, I wear slippers through the house now. So that in one way going forward, as we live with COVID, as we go back to work, you may need to consider basically having two sets of, your outdoors, your work clothes, okay, work shoes, and your indoor shoes, okay. Now, I don't know if I'm ever going to go back to wearing bow ties again, because I don't know when this pandemic will stop. I may be wearing this. Certainly, because I'm paranoid, I probably will be always leaving the shoes I come outside in the mudroom. There is no evidence that unless you've got direct contact with your shoes and can wipe it and go to the T-zone, but take it on and off. But I think out of abundance of caution, it is very reasonable to change your shoes. Okay, I would recommend that, but again, there's no science for that. That's me.
Mm-hmm.
There was a.
Sorry, go ahead.
No, it flashed up. There was a question about whether mosquitoes cause COVID. No, that gets straight out. There's no evidence of mosquito transmission, even when they've been down on places where it's now, okay, I should mention, there has been a hope that as the summer came on and so forth, the COVID was gone away. But now we're seeing the epidemics, in Dominican Republic and Haiti, Africa and so forth, places that are hot, okay, places that are sunny. It doesn't look so, again, there's no reason to expect COVID to disappear in America over the summer.
Wow. Debbie Clemens had a question. Debbie?
Oh, wait, I have to unmute myself. Can you hear me?
Yes.
I can hear you.
Okay, my question was, what are the chances of this virus being man-made? For instance, germ warfare that got out of hand.
Okay. Oh, no. All right. So it turns out after SARS-1, the first epidemic in China that they identified it to bats, the Chinese government started studying coronavirus. All right. And indeed, there are 2 laboratories studying coronavirus in Wuhan. Okay. However, when you do bioweapons and so forth, means you're manipulating the viruses, that leaves a signature. There's no way you can change the DNA of a virus or the RNA of a virus without leaving a chemical trace because of the way of the chemicals that are used to basically cut genes off and mix genes together. That leaves a mark, okay? So there is no evidence that this virus is man-made. SARS-1, COVID-1, the original one that caused the Chinese pandemic in 2003 was naturally occurred. Okay, here's the deal. Certain viruses are common in people, and certain viruses are common in animals, and you can get cross-reactivity. It turns out that HIV, human immunodeficiency virus, HIV, was actually started out as a simian virus that did not cross over to people until people in the Congo started using apes for food. And it turned, there have been some studies that show now that indeed 10 years before because now they can check the DNA, the genetics of every virus now. They can look at the pattern, they can track it down, they can identify it. That's how they can tell whether things are man-made or not. Because if you snip and slice and dice the DNA, you leave a mark with it. Similarly, what happens is that viruses from animals and people cross-react. Like you've heard of the Hong Kong flu, but you've never heard of the Pittsburgh flu, because what happens is you've got most of the viruses have come in animals. Okay, there has to be a way where the humans and animals closely interact, and indeed these markets, Wuhan is the meat market for China. And so you've got large pens where you've got ducks and geese and pigs and so forth together. You also have exotic animals. Original SARS-1 came from bats, because bats are used for food and for certain medicines. Okay, there's certain Chinese herbs and things that require, eye of newt or whatever. You can get what you want in China. After that first pandemic, excuse me, after the first epidemic of SARS, the government studied it and initially wanted to ban exotic animals. But there was such a hue and cry among the people there who want the Chinese medicine that they kept the animal. They made an exemption for exotic animals. And that's why there's still exotic animals there. The government did study the virus and indeed was receiving money from the American government through, I believe it was Stanford University, one of the American universities, to study the coronavirus. Trump, of course, cut that money. So they were studying the virus, and certainly no one more than Trump wants this to be a plot by the Chinese government. But there's no evidence. But all the information we can have about how, because they've looked at this high and low, and if there was any evidence that this was that this COVID virus was man-made, was manipulated, man, they've been trumpeting that from the rooftops.
Mm-hmm.
So it is natural. It's a tragedy, but it is natural.
Mm-hmm. Any other questions? Anybody else have a question? If so, let me see your hand. Okay. Well, join me in thanking Dr. Patrick.
Well, I got one more thing.
Oh, okay.
This is my church family. No, that in my prayer life, because I've been wondering why, all right? This was a hard Easter for me, because normal Easter, I grew up in the church. Easter's a fun time, okay? The music, the light, he is risen. This was an Easter of quietness, sadness, okay, reflection. So in my prayer life, I've been, what is God, what might God be trying to tell us? And I was taught that in many ways, this Easter was very much like the first Easter. Remember, the disciples did not know that Christ had risen. The disciples are huddled in the room, fearful, afraid somebody's going to come get them. In the morning, what can I say? The women come to take care of business. Okay, the men are still back in the room. The women have come to prepare the body, and they're the first ones who find that Christ has risen. They're the first ones to get to, and they bring back the news. And the men come running in, and only Peter has the courage to go in and actually look and see things. So I'm wondering, but remember that first Easter, God started a new thing. He brought a new change in the world. And maybe this is something that he's doing here too, to remind us about what's important. Certainly, all the busyness, all the activities, all the running around that I did, I don't do now. I now walk to work so that I can get some sunshine. And I thought of all the times I've been just driving to work in a hurry, thinking ahead, not looking around. I've taken this time now to hear the birds, to actually look around, and you see the green, and there's so much joy there that I was just not paying attention to. So that I wonder, praying about what's God trying to tell us here? What's God trying to tell me? Okay, He's telling me I don't have control, even with all my precautions, even garbing up and suiting up and wearing all the stuff, changing my clothes, okay, leaving my shoes outside. I can still get this. I can still get sick. I don't have control. All I can do is lean on the Lord. And when I'm taking care of patients, I do the best I can for them, but I don't decide who lives and dies. He does. The humility of recognizing, and maybe the thing that God wants to tell me is to remind me of my place in this thing, my place in the scheme of things. And so, and to really boil it down, what is important? What do I need to do? What is, the things that I have, what's really optional? What's mandatory? What gives me joy? What things can I let go of? So I've been praying about that and reflecting that. And so I offer because this is my church family, I offer my thoughts, my reflections, my prayer life to you.
Oh, how wonderful, how wonderful. Join me in thanking Dr. Patrick. And Judith on the side. Tell Judith to poke her head out so we can see her.
Come on. Yeah, your hair's not done. Just want to see your hair's done. Y'all, I should say I have women who will not do a video visit with me, but only phone visit because they don't want me to see how they look, or they don't want me to see how messy their house is. All right? They told me that straight up.
So we're going to go. We cannot thank you enough for doing this. We cannot thank you all for getting on this call and asking your questions. I see folks from Corone. I see folks from Baptist Temple. We are so glad that you joined us tonight. And again, look at God providing everything we need from within the house. And so we have to take heed to what Dr. Patrick said. I want to thank Audra too, who really helped organize this and put this together and gave us all our credentials and really set things up. And so this is going to be uploaded to YouTube. So you'll be able to see and hear anything that you've missed. We were able to record this, the information only. So I won't see any of your hairstyles and anything you all were afraid to do. Y'all blowing your nose and carrying on and cooking. You won't see all that, but you will see and hear the information. So Rev Dar, since I see you, I'm going to ask you to pray us out, if you don't mind.
Do not. I will take great solace in that. Let us pray. God, you are the source of everything we need. And as Dr. Patrick just said, you are the only one who can give us the strength. Matter of fact, you've already given us the strength, but it's only your strength that will keep us walking and keep us walking until we get to the end. And so, God, we pray that we will continue to call on you, call on your name, that we will continue, as we heard earlier, continue to call each other, continue to hold each other up, continue to reach out, continue to listen to the good science, not spread any false rumors, not pass on articles that we have not read, but that we will be wise and we will be smart, we will be loving, we will be compassionate and not judgmental. Let us get to the end of this thing, Lord God, having dropped off some of the things that have weighed us down. And so, God, as we continue to walk this walk, we know that not only are we not walking this walk alone because we're walking with each other, but most importantly, God, because we're walking with you, because you promised, God, you promised that you would never leave us or forsake us. We're so grateful, God, for having Dr. Patrick to share with us and to share with us with you in mind. We're so grateful for that. And God, as we leave this space, how wonderful it is that we can still gather. But as we leave this space, Lord God, we pray that we will continue to lift up our heads and continue to love on you and love on each other. In Jesus' name we do pray. Amen.
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 Amen.